something. May is Mental Health Month, and again, we tend to talk about mental health awareness. That's been a constant theme since last May, Mental Health Month. And one of the things we're really interested in the work we're doing is moving past the awareness. I think to some extent the pandemic has created an awareness of mental health issues. If there is a sliver of a silver lining, perhaps that's it, because we're all dealing with some form of it or other. But more from awareness into action. And in your opinion, what are the things we can do to help repair our mental health system? I know you touched on screening.
Mm-hmm.
What are your thoughts on that?
This is such a big and complex and very important topic. And I think you can think about it, at so many different levels: the societal level, the legislative action level, the clinical level. And I think you're right that stigma has been decreasing and awareness has been increasing, awareness of the importance of mental illness. I think we still have a ways to go with that. Sure. And I think the more people are just willing to talk about it, and, the better it gets, the more open people are. And it just I think that helps decrease the stigma that I think is still there to some degree. But again, it is so much better. I think the mental health system has suffered from so many challenges, reimbursement challenges, too few clinicians, inadequate access to care, inequities in access to care. And, we need changes on so many levels as well. I mean, at the societal level, we just need more access to care, I think, especially for disadvantaged groups like the homeless, mentally ill. We need broader implementation of the federal parity law so that mental health care is reimbursed just like physical health problems. Mm-hmm. And I'm a big fan of telehealth, virtual healthcare, which I hadn't used before the pandemic struck. And it has just been terrific, and my patients love it. And I think this also increases access. It's so much easier for patients not to have to travel to their clinician's office, especially, if there are often transportation barriers. And so this clinician's ability to provide telehealth is certainly expanded during the COVID-related national state of emergency. And I think continued use will continue into the future. I hope so. And I hope that there have been restrictions on use. I hope that those won't be reinstituted when the current state of emergency ends. I hope that payment parity continues for telehealth visits. I think at the clinical level, we certainly need more mental health clinicians and better identification of mental illness. And as I mentioned, we need more widespread use of validated screening and diagnostic measures. I think mental health conditions, especially those like BDD, patients with BDD may be are often embarrassed and ashamed of their concerns. They may be a little reluctant to volunteer that they have worries about their appearance to their clinician. And yet if they're asked, they will typically talk about it. So screening for BDD and other conditions that are easy to miss in clinical practice is so important. And I think it's important to make this screening digital and part of electronic health records as well. We also need better monitoring of symptoms during treatment. Mm-hmm. I don't want to treat to the point where my patients are only 50% better, even though that's great, but I try to get them to 90% better, 100% better. And so tracking improvement with a measure of some sort, a scale of some sort is so helpful in getting patients to recovery. And I would just also like to mention, there's an often repeated myth about mental illness, which is that we don't have very good mental health treatments. And I wonder and I worry to what extent this has discouraged people from seeking care. And it's really not true that our treatments aren't good. We can substantially improve most of the disorders we treat with the treatment we have now. Mm-hmm. If they're recognized, they're screened for, they're diagnosed, and they're well treated. And I think, the glass is half full, more than half full rather than half empty in terms of the effectiveness of our treatments. I mean, of course, we always need more research studies. We need to further improve the treatment options. But I just want to mention that we have good treatments. And so that makes it even more important to screen for and identify a whole variety of mental health disorders, including body dysmorphic disorder and olfactory reference disorder.